Welcome to Trending Unpacked, where we explore what people are searching for and why it matters. Today, we're looking at something that seemed to have, well, really jumped onto the global radar quite suddenly,
Yeah.
especially with summer travel kicking into high gear. We're talking about the chikungunya virus. Now, for a lot of people, its prominence might feel a bit out of the blue, but the story behind why it's surging in searches right now, it actually tells us a lot about our connected world, climate, and, yeah, the changing face of global health. So in this conversation, we're going to unpack what chikungunya actually is. We'll try to understand the reasons it's trending globally now. We'll explore its impact, which is pretty significant. And importantly, figure out what lessons we can all take away from this whole situation. Get ready for a proper look at something more complex than just a news headline.
Why the topic is trending now.
Okay, let's get straight into it. Why are so many people suddenly searching for chikungunya in 2025? Like I said, it feels like it popped up almost from nowhere for some of us. What's really driving this surge?
Yeah, it does seem that way for many, doesn't it? But its current trending status isn't really down to just one single thing. It's more like a confluence of several pretty significant factors all hitting at once. Probably the most striking one is the clear evidence of new outbreaks, and crucially, a dramatic geographical expansion. We're not just talking about isolated cases from travelers anymore. We're seeing confirmed local transmission, meaning the virus is spreading within communities in places way outside its usual tropical zones.
Like where specifically?
Think parts of the southern U.S., certain areas in Italy, and there's an escalating situation in India, too. The key thing here is that it's not just people bringing the virus back. It means the mosquitoes carrying it, the Aedes mosquitoes, are now actually thriving, breeding, and passing the virus on locally in these, well, previously less affected areas. That fundamentally changes the game, the whole epidemiology of chikungunya.
Right, so it's not just a tropical disease anymore, staying put in the tropics. That really implies a huge shift in where we might encounter it. What makes these newer areas vulnerable now?
That's exactly it. The mechanism behind the spread is the critical part. It's largely down to warmer climates, boosted by these global temperature shifts we're seeing. This is basically extending the habitable range for Aedes aegypti and Aedes albopictus mosquitoes, the main carriers.
Ah, the tiger mosquitoes. Because of the stripes.
That's them, sometimes called that, yeah. And they're incredibly adaptable, masters at colonizing new areas. So in places like the southern U.S. or parts of Europe where maybe colder winters use it to keep them in check. Now, longer warm seasons mean they can get through more breeding cycles, live longer, spread further north. And this creates a real vulnerability. Health systems might not have been looking for chikungunya before. There's no built-up immunity in the population. Doctors might not recognize the symptoms right away.
Leading to delays in diagnosis?
Exactly. And potentially wider spread before it's even identified. It's a game changer because the risk shifts. It's not just about traveling to the tropics anymore. It's potentially a risk for residents in some temperate zones too.
Wow, okay. That is a serious development, a much broader threat. And I guess such a big geographical shift must be triggering some kind of major international response, right? What are we seeing officially?
You're right to connect that. The second big catalyst and a really clear signal of how serious this is becoming is the World Health Organization, the WHO. They've issued an elevated health alert specifically for chikungunya.
And what does that actually mean, an elevated health alert? Is that common?
It's definitely not just a routine thing. It's a significant step. It signals urgent concern about how fast a disease is spreading, its potential to cause widespread illness. And it's basically a direct call for stepped-up global surveillance and public health action.
Okay.
So for chikungunya, this alert means more focus on finding cases early, responding quickly, countries working together to track and control outbreaks. It essentially puts governments and health agencies worldwide on notice, Pay attention. This is a growing global threat. We need coordinated action now. It really underlines that this isn't just a regional issue anymore. It's a global public health priority.
That definitely conveys urgency. But amidst all this, which sounds quite concerning, I think I've also heard whispers of some more hopeful news from the science side. Is there anything positive balancing this out?
Absolutely. And, this positive angle is almost certainly feeding into the search interest, too. We are seeing some very promising new vaccine candidates for chikungunya moving into late-stage clinical trials, phase 3 trials.
Really? That's huge, isn't it? Because there hasn't been a vaccine before.
Correct. For decades, managing chikungunya has really just been about managing symptoms, pain relief, fever reducers, plus trying really hard with mosquito control. There hasn't been any specific antiviral drug or a vaccine. So the prospect of an effective vaccine finally getting to these last crucial stages, that offers genuine hope for prevention.
Wow.
This news isn't just a potential breakthrough against future outbreaks, it also highlights that massive global scientific effort trying to get ahead of these emerging diseases. It naturally makes people search, is a chikungunya vaccine coming soon? That drives discussion.
Okay, so we've got widening outbreaks, a major WHO alert, but also this real hope for a vaccine. And all this is happening right smack in the middle of peak summer travel season. It feels like a perfect storm of factors.
It really is. The timing is incredibly significant. You have millions of people planning trips, often to tropical or subtropical spots where chikungunya might be present. And then they see travel advisories pop up warning about chikungunya.
Yeah, that would make you search for it.
Exactly. It taps right into that basic need to be prepared. You're planning a family holiday, something you've looked forward to, and suddenly there's news of outbreaks near your destination. Your instinct is to find out more. What's the risk? How do I protect myself? So that high search volume, it's a direct result of this collision. Our love of travel meeting the reality of these evolving health threats. It really nails the why it's trending question. It's our interconnected world bumping up against infectious disease dynamics.
You mentioned specific regions earlier, beyond the new expansion areas. Are there particular hotspots that are still major areas of concern, maybe driving a lot of the numbers overall?
Yes, that's a really important point. While the spread into new areas gets headlines, we absolutely have to remember the ongoing, often worsening burden in traditional endemic regions. Latin America, for instance, has seen a really alarming rise in cases recently. Countries like Brazil and Paraguay have reported huge increases.
Why there, particularly?
Well, they face big challenges. Large cities, sometimes with infrastructure that makes mosquito control really difficult, and climates that are just perfect for Aedes mosquitoes all year round. The sheer number of cases in these hotspots puts enormous strain on their health systems, and that contributes significantly to the global picture and the overall concern feeding back into searches. These areas constantly remind us of the virus's potential for explosive outbreaks in dense populations.
Given all these complex factors, what are public health agencies actually doing on the ground? It sounds like a massive undertaking.
It is monumental, no question. And agencies in affected areas, and even those just at risk, are mobilizing. Their strategies have several parts. First, they're ramping up mosquito surveillance, setting traps, monitoring populations, identifying high-risk zones.
Okay.
Second, they're pushing hard on mosquito control. Not just spraying, though that's part of it. It involves community efforts, getting rid of standing water, using larvicides in water that can't be removed, targeted spraying when needed.
Right, getting rid of breeding sites.
Exactly. And third, crucially, public awareness campaigns. Educating people about how to protect themselves, what symptoms to look for, and why getting rid of those water containers around homes is so vital. The visibility of these campaigns also feeds into public awareness and searches. As people see the official advice and want more detail, it's a really concerted effort to contain the spread and empower people.
Context and background understanding chikungunya.
Okay, so now we have a much clearer picture of why chikungunya is trending. Let's maybe take a small step back. For listeners who might still be a bit unfamiliar, what is chikungunya exactly? And what really sets it apart from other mosquito-borne things we hear about, like, say, dengue or malaria?
Good question. Context is key here. Chikungunya is a virus. To be specific, it's an arbovirus.
Arbovirus.
Yeah, it just means arthropod-borne virus, basically spread by insects like mosquitoes or ticks. It gets into humans primarily through the bite of an infected mosquito. And here's that connection we need to make. The main carriers are the Aedes aegypti and Aedes albopictus mosquitoes.
Ah, right. You mentioned them before.
Yes, and crucially, these are the very same types of mosquitoes that spread dengue and Zika.
Okay, that helps place it.
It does. It means if you live in or travel to areas where dengue or Zika are a known risk, the environment is already suitable for chikungunya transmission. What makes these Aedes mosquitoes such a problem? Well, several things. They often bite during the daytime, unlike, say, the malaria mosquito, which is more active at dawn and dusk.
So harder to just avoid being out at certain times.
Exactly, and they thrive in urban areas. They lay eggs in tiny amounts of standing water, literally in our backyards, cities. And they tend to bite multiple people in a short time. Right. Makes them really efficient at spreading viruses.
That connection to dengue and Zika vectors is really helpful, yeah. It grounds it for people. And it sounds like this virus isn't exactly new, is it? Where did it come from, and how did it get that really unusual name?
No, definitely not new. It was first properly identified way back in 1952. That was during an outbreak in southern Tanzania. And the name itself has this fascinating, really descriptive origin. It comes from a word in the Makonde language spoken in southeast Tanzania and northern Mozambique. And it means something like that which bends up or to walk bed over.
That which bends up. Wow.
Yeah, it's incredibly vivid. It refers directly to the most debilitating symptom. Patients are often literally forced into this stooped, bent posture because the joint pain is so excruciating. It's one of those rare cases where the name of the disease perfectly captures the experience of suffering it causes, makes it very memorable, gives you an immediate sense of what it's about.
That which bends up.
Wow.
That phrase alone just conveys agony. Can you maybe elaborate a bit more on the symptoms, especially what makes it so distinct, that joint pain?
Sure. So the typical symptoms usually show up maybe 3 to 7 days after the mosquito bite. It often starts suddenly. High fever, severe muscle aches, bad headaches, sometimes a skin rash. But the thing that truly defines chikungunya, the reason for its name, is the crippling joint pain. The medical term is polyarthralgia pain in multiple joints.
Crippling, you say, not just achy.
No, not just achy. We're talking agonizingly intense pain. It often hits multiple joints at once. Hands, wrists, ankles, feet are really common. Imagine pain so bad that just walking or holding a cup or turning a doorknob becomes incredibly difficult, almost impossible.
That sounds awful.
And this pain, it doesn't always just go away quickly. It can linger for weeks or months, and for a significant number of people, it could even last for years after the initial infection. It becomes chronic.
Years.
Yes. It transitions from an acute illness into this long-term debilitating condition. Now, importantly, the mortality rate for chikungunya is generally very low. It rarely kills people. But, and this is huge, but the illness itself is incredibly incapacitating. It leads to prolonged suffering, a massive hit to quality of life, significant disability. It's this long-term morbidity, not mortality, that makes it such a serious public health concern. That's why people are paying attention.
Okay, so the key thing is, usually not deadly, but it can completely knock you out for a very long time. That's a really critical distinction for understanding its impact. Are there common misconceptions about it? Things people often get wrong that you'd want to clear up for listeners?
Yeah, there definitely are. Usually because it shares some features with other mosquito-borne diseases. The most common one is probably mixing up chikungunya with dengue or even malaria.
Right. Fever, mosquitoes. Easy to lump them together.
Exactly. But while they all involve mosquitoes and cause fever, they're very different illnesses.
Yeah.
Different management, different public health responses needed. Malaria, for example, is caused by a parasite, not a virus. And it's spread by a different type of mosquito, Anopheles, which has different habits. So controlling Aedes mosquitoes won't necessarily stop malaria.
Okay.
And dengue, well, it shares the same Aedes vectors and some early symptoms like fever and headache. But its hallmark isn't really chronic joint pain. Dengue is more known for severe headache, pain behind the eyes.
Yeah.
And in severe cases, it can cause bleeding problems or shock, which you generally don't see with chikungunya.
I see. Different danger profiles.
Very different. Understanding these distinctions is vital. For doctors making a diagnosis, obviously, but also for the public, to avoid unnecessary panic, or maybe worse, a false sense of security. We need to get past thinking, oh, it's just a mosquito bite, and really grasp the unique, long-lasting pain chikungunya can cause. It's about understanding the real threat, even if it's often not a fatal one.
Cultural, social impact, and contributing factors to spread.
Okay, this is where the chikungunya story really seems to connect with, well, everything else going on in the world.
Yeah.
Beyond the virus itself, how is this outbreak playing out socially, culturally?
Right.
What are these bigger forces, maybe even things we don't always see, that are helping this virus not just trend online, but actually spread across continents so effectively?
This is where it gets really complex, right? It highlights how public health works in the 21st century. Chikungunya's spread isn't just biology, it really mirrors our global trends, our societal choices, and probably top of the list of factors helping it spread globally, you have to say climate change.
Yes. You mentioned warmer temperatures helping the mosquitoes.
It's huge. Rising global temperatures aren't just about hotter summers. They are literally redrawing the map for Aedes mosquitoes. These insects are cold-blooded. Their whole life cycle, how fast eggs develop, how quickly the virus copies itself inside them, it's all very temperature dependent.
Mm.
Warmer conditions mean they develop faster, they can fit more breeding cycles into a season, the virus becomes infectious inside them quicker. So it's not just tropical diseases staying tropical anymore, it's previously temperate areas becoming welcoming habitats. Places in Europe, parts of the US, where maybe they couldn't survive cold winters before, now they can. It's like we've inadvertently opened up highways for this pathogen across the globe just by warming the planet.
So climate change is basically giving these mosquitoes a passport to new territories. What other human factors are kind of setting the stage for these outbreaks, maybe without us realizing it?
Another really significant one is urbanization, just the sheer speed and scale of it. As more and more people globally live in cities, we are, somewhat ironically, creating perfect breeding grounds. Ideal incubators for AIDS mosquitoes.
How so?
Well, think about all the artificial places water can collect in a city. Discarded tires, plastic containers lying around, forgotten flower pot saucers, clogged gutters, leaky taps, even little puddles on construction sites or in drains.
Tiny amounts of water.
Exactly. Each one can be a little nursery for mosquito larvae. Now, combine those abundant breeding sites with high human population density, millions of potential hosts living close together. That creates an incredibly efficient system for the virus to spread rapidly. More people close together means more chances for a mosquito to bite someone infected than quickly bite someone else nearby who isn't infected. It just accelerates the whole chain. It really shows how the way we build and live in our cities directly impacts disease spread.
It really sounds like our modern way of life, climate impact, city living, is unknowingly rolling out the red carpet for these viruses.
Yeah.
And I imagine the sheer amount of international travel doesn't help either.
Oh, it's probably the fastest accelerator of all. International travel acts like this incredibly efficient global conveyor belt. Someone can get infected with chikungunya in one country, and because the incubation period can be a few days, they might feel fine, board a plane, fly across continents before they even start feeling sick, or maybe while they just have mild symptoms.
Right. They wouldn't even know.
Exactly. Then they arrive in a new place. If Aedes mosquitoes are already present there, a local mosquito bites the infected traveler, picks up the virus, and then can start spreading it to local residents. That kicks off a whole new local outbreak.
Wow.
The speed, the volume, the interconnectedness of global travel today, it means a local outbreak somewhere can become a global concern really, really quickly, faster than ever before. It's a constant reminder of how connected and maybe how vulnerable our world is.
That paints a really clear picture of the physical spread. Let's shift a bit to the public reaction. When news like this breaks, especially with travel on people's minds, how does it play out on, social media? And why do we often seem drawn to the scariest version of the story, even if the facts maybe don't fully support that level of alarm?
That's such a relevant question today, isn't it? It gets to the core of challenges in communicating health information. On social media, you often see what I might call amplification loops or even panic cascades. Posts get shared, often stripped of context, maybe exaggerated a bit for clicks or shares, and they can quickly sensationalize the situation.
Right.
With chikungunya, even though we know the mortality rate is low, you'll still find posts making it sound like a deadly plague. Why do we gravitate towards scary stories? Well, it's partly psychological. Fear is a powerful primal emotion. It grabs our attention.
No.
And social media algorithms often prioritize content that gets high engagement, clicks, shares, comments. Fear-inducing stuff often gets high engagement, so it creates the cycle where fear spreads, sometimes faster than accurate information, which makes it really hard for reliable public health messages to cut through the noise. It can lead to unnecessary anxiety or, weirdly, the opposite, people dismissing it all as fake news and not taking the real debilitating effects seriously.
And alongside those kinds of panic posts, I've definitely seen people sharing so-called mosquito defense hacks online.
Yeah.
On TikTok or wherever. Are those generally useful? Or are they just adding to the confusion?
Oh, this is a major headache for public health folks. These trending hacks, things like citronella bracelets, those ultrasonic repellent devices, various DIY sprays with essential oils, sadly, they're often just ineffective. Or at least they don't provide nearly enough protection.
Really? People swear by some of them.
I know, but the scientific evidence often isn't there. Some natural things might have some repellent effect, but usually not strong enough or long-lasting enough compared to properly tested repellents. The real danger isn't just that they don't work well, it's that they give people a false sense of security.
Ah, right. So they rely on that instead of something proven.
Precisely. They might skip using a recommended repellent with DT or picaridin, things we know work well because they think their bracelet or oil blend is doing the job. And this ties back to those misconceptions we talked about. People might just think of it as any old bug bite or confuse it with something less severe, so they use these unproven methods. They underestimate the risk of a virus that can cause such severe long-term pain. It's really problematic because it diverts attention and effort away from strategies that actually work and potentially leaves people more vulnerable.
So it's not just about whether they work, but the dangerous misdirection. False security. It sounds like the absolute key here is to keep emphasizing the debilitating reality of chikungunya, even with that low death rate.
Exactly. Cannot stress this enough. We have to keep underlining how debilitating this illness is. That severe, often chronic joint pain. The low mortality rate is good news, of course, but it absolutely doesn't diminish the public health concern. Think about the ripple effects through society. Imagine a small business owner who literally can't work for months because of the pain. What does that do to their family, their employees, the local economy?
Yeah.
Or a parent or caregiver who's incapacitated. How does that affect the people depending on them? This long-term morbidity means lost wages, higher healthcare costs for managing pain in rehab, lower productivity, and just a huge, often hidden reduction in quality of life for potentially millions of people.
It's not just a personal health issue then.
Not at all. It's a burden on healthcare systems which might not be set up for a surge in chronic pain patients. It's a drag on economies. That's why chikungunya is serious, why it demands attention, even if it doesn't often kill. The public conversation really needs to shift from just asking, is it deadly, to understanding how badly does this impact life, well-being, and society. It's this hidden epidemic of suffering.
Health recommendations and a forward look.
Okay, so after covering all that ground, what does this all mean for us, for you listening, as you maybe plan summer trips or just go about daily life? What are the really key takeaways, the practical, actionable steps we can actually use to protect ourselves and maybe our communities?
Right. This is where understanding turns into empowerment, hopefully. The absolute most critical, practical step, especially if you're traveling to or living in an area where chikungunya is active, is using insect repellent consistently and correctly.
Which kind is best? There are so many.
Look for products containing either DEET or picaridin. Those are really the gold standards. They've been rigorously tested, proven very effective against these Aedes mosquitoes.
What strength does that matter?
For DEET, aim for a concentration around 20–30% for adults. Picaridin at about 20% is comparable. And always, always follow the instructions on the label about how often to reapply it. Put it on all exposed skin whenever you're outdoors, especially during the day when these mosquitoes are most active. It's your first line of defense. Think of it like, an invisible shield.
Repellent first. Got it. What else? Other protective things. Clothing around the house.
Yes, simple things add up. Protective clothing definitely helps in high-risk areas. Long sleeve shirts, long pants, just minimize the amount of skin exposed. Less area for them to bite. Some people say lighter colored clothing is better too, as dark colors might attract mosquitoes more. Worth considering.
Okay.
And then, beyond protecting yourself directly, one of the most impactful things we can all do is source reduction. Getting rid of mosquito breeding sites.
You mean clearing out standing water?
Exactly. Systematically, regularly, around your home and in your community. Empty water from flower pot saucers, pet bowls, bird baths. Check old tires, tarps. Make sure gutters aren't clogged. Anywhere water can collect.
Even tiny amounts, right? You said that earlier.
Even tiny amounts. A bottle cap can be enough for larvae to develop. Make it a weekly check. This isn't just self-protection, it's a community effort. Every breeding site you eliminate helps reduce the overall mosquito population in the area. Safer for everyone.
Those are really clear, practical things people can actually do. That's empowering. But with so much information flying around, some of it confusing or wrong, how do we make sure we're getting reliable updates to make good decisions?
Staying informed from trusted sources is just crucial in this day and age. I'd strongly urge listeners, prioritize information from recognized national and international health organizations. The World Health Organization, WHO, the CDC in the U.S., your own country's public health agency, your local health department.
Their websites usually have current info.
Yes, they provide accurate, evidence-based updates on outbreaks, prevention advice, travel recommendations, learning to spot credible sources versus, sensationalized social media posts or anecdotes. That's a vital skill now. It's not just about getting information, but evaluating it critically so you can make genuinely informed choices about your health and travel.
So, thinking about the bigger picture here, chikungunya's resurgence feels like more than just a temporary news item. It seems like a real symptom of these larger global shifts we're all experiencing.
I think that's exactly right. If you connect all these dots, chikungunya's comeback had spread into new areas.
Mm.
It vividly illustrates this complex dance between climate change, our incredible global interconnectedness via travel and trade, and, well, public health. It's a really stark reminder that diseases don't care about borders on a map, and that
Yeah.
changes in our environment have direct, sometimes devastating impacts on human health. This whole situation just underscores how vital ongoing scientific work is, especially vaccine development, getting those promising candidates over the finish line. And also the critical need for strong, globally coordinated health surveillance systems. They're like our planet's early warning system, essential for spotting and containing these emerging threats quickly before they spiral out of control. It really shines a light on our shared vulnerability, but also on the power we have when we work together globally. And, this whole story raises a bigger question, maybe a provocative one, for all of us living in this changing, connected world. How do we find the right balance between, on one hand, taking personal responsibility, using repellent, clearing water, staying informed, protecting ourselves from immediate threats like chikungunya, and on the other hand, our shared global responsibility to tackle the root causes driving these problems like climate change, like managing urbanization better, like
Right.
building stronger health systems everywhere? Are we just going to keep reacting to crises as they pop up? Or can we actually evolve, adapt, innovate to try and shape this changing landscape of health challenges more proactively?
Yeah.
It's a profound thought, something to really mull over, especially since these trends aren't slowing down.
That is a powerful thought to leave us with, the evolving nature of these challenges and our collective role or individual role in what comes next. Next time on Trending Unpacked, we trade mosquito buzz for movie buzz, unpacking the mystery and hype around the 2025 film Weapons. Thank you so much for joining us today, and huge thanks to our expert for sharing such valuable insights on this really critical topic. We hope you keep exploring, keep staying informed, and we'll talk again soon.